So guys, my name is Dr. Mohammad Wajid Ali Khan. I have been working as an anesthetist and intensivist. So I'm here to help you with the topics of anesthesia. So guys, we'll be starting with this topic called as local anesthesia. Local anesthetics. Local anesthetics. Local anesthesia, as we have already discussed, local anesthesia meaning what, guys? Local anesthesia meaning what? A small area you're making it numb, that is called as local anesthesia. We are talking about local anesthetics. Local anesthetics. What are local anesthetics? Local anesthetics are the drugs that are given in local anesthesia, spinal anesthesia, epidural anesthesia and nerve blocks. Except for general, local anesthetics are given in all anesthesia techniques. So you can just write there. Local anesthetics are drugs that are used in local anesthesia, spinal anesthesia, epidural anesthesia and nerve blocks. So basically, except for general anesthesia, local anesthetics can be used in all anesthesia techniques. In general anesthesia, we require a special form of drugs. Means what? Special form, not local anesthetics. We can give IV drugs or we can give inhalational. That is general anesthesia. Okay. So local anesthetics are used in local, spinal, epidural and nerve blocks. Now what we need to discuss in local anesthetics, we need to discuss the classification, we need to discuss the metabolism, we need to discuss the mechanism of action. Starting with the classification. These local anesthetic drugs are classified into two categories. One category is called as amino ester category, whereas the other category of drug is called as amide category. One is amino ester, other is amide category. There have been MCQs asking, tell me the drug which is amino ester or tell us the drug which is an amide. The easy way, remember guys, the easy way to solve this MCQ over here is what? Remember a small thing over here. Right? I told you the drugs are classified into amino ester or amide. Look at the spelling of amino ester and tell me how many alphabets of I are there in amino ester. How many, guys? I could see only one I. Only one I. As amino ester is having one I, all the drugs that are there in amino ester will have one I. All drugs of amino ester will have a single I or a one I in it. Whereas amino-amides, look at the spelling of amino-amides, guys. Amino-amides, how many alphabets of I are there in amino-amides? 1, 2. 2 alphabets are there in the spelling amino-amide. Hence, all amino-amides will have 2 I's. All the drugs of amino-amides will have 2 I's. Starting with the first drug which is called as amino ester. Amino ester. So guys, I told you we are discussing about the classification. Starting with amino ester. What are the drugs that belongs to amino ester category? In amino ester, you are having a drug called as cocaine. It was the first introduced local anesthetic. Cocaine was the first used local anesthetic. Are we using cocaine for local anesthesia purpose, guys? No. Cocaine was the first introduced local anesthetic. Nowadays, it is the most abused drug. Nowadays, it is the most abused local anesthetic. After cocaine, there is Procaine. Cocaine is there. Procaine is there. Chlorprocaine is there. Cocaine, procaine, chlorprocaine. Benzocaine and tetracaine. All these drugs have one thing in common. All are having single eye. All are having single eye. Right? So remember, amino ester means single I. Cocaine, procaine, chlorprocaine, benzocaine and tetracaine. All are having single I, so they belong to amino ester category. Next, after amino ester, next form of drug is called as amide. Amide, right? So I told you local anesthetic, they are classified into two groups. One is amino ester, other is amide. Now in the amide, what are the examples, guys? Remember, amides, they will have two I's. Starting with the first drug, the most commonly used amide worldwide, Lidocaine, also called as Lidocaine, also called as Xylocaine. Lidocaine, also called as Lidocaine or Xylocaine, right? Now don't get confused by looking at the spelling of Xylocaine and tell me that, sir, Xylocaine is having one I now, so it will belong to amino ester. No. Xylocaine other name is Lidocaine or Lidocaine. These are having two I's, so these are amides. It is the most commonly used local anesthetic worldwide. Most commonly used local anesthetic worldwide. It is Lidocaine. Next amino amide that we need to remember is Bupivacaine. Bupivacaine is also an amino amide, right? It is the most commonly used local anesthetic in spinal anesthesia. When Lidocaine is available, when Lidocaine is the most commonly used local anesthetic worldwide, why do you go for Bupivacaine? When Lidocaine is the most commonly used local anesthetic worldwide, everywhere it is available, why do you go for Bupivacaine in spinal? Why? Because Bupivacaine is a bit long, it acts for a bit longer duration when compared to Lidocaine. Right? Next, Mepivacaine. Again an amide. Next, Prilocaine. Last, Dibucaine. Right? So all the amino amides are having two I's, whereas amino esters will have one I. Just remembering all the names of the drug, I can understand. If it is a new thing for you, it will be a bit difficult. We will learn it with time, but you have to solve the MCQs right from the go, right? You have to solve the questions right from the go. So how will you solve the questions of amino ester, amino amide? Amino ester means one I, amino amide means two I's. Any drug that is amino ester will have one I, any drug that is amino amide that will have two I's. So that's the classification. That's the classification of amino ester and amino amide. Now in your notes there are two MCQs also given, guys. Which of the following is not an amino ester? Come on, guys. Cocaine, procaine, prilocaine, benzocaine. Which is not an amino ester? I'll give you a few seconds time. Then I'll mark what's the question. What's the answer? Cocaine, procaine, prilocaine, benzocaine. Which is not an amino ester? Which is not an amino ester? Cocaine is an amino ester. Why? Because it's having one I. Procaine, amino ester. Benzocaine, amino ester. Which is not an amino ester? Prilocaine. Why, sir? Prilocaine, two I's, yani ki it is amino amide. Next is what? Which drug is an amino amide? He's asking which drug is an amino amide, or basically he is asking you in simple language, which drug is having two I's? Amino amide has two I's, no? So the amino amide drugs will have two I's. So what's the answer? Procaine, Lidocaine, benzocaine, tetracaine. Answer is very simple. Which is an amino amide, guys? Lidocaine. Why? Why? Because Lidocaine is having two I's. Lidocaine is having two I's. So remember, this is regarding what? This is regarding the classification of local anesthetics. So local anesthetics are classified into two categories. What two category? One is called as amino ester, other is called as amino amide. Amino ester yani ki single I. Amino amide means two I's are there, right? Now next, guys, coming to the metabolism of local anesthetic. Guys, whenever we take any drug, take it as paracetamol only, Dolo 650 tablet. Whenever you take any drug, it basically goes towards the liver, have metabolism in the liver, and then it is excreted through the kidneys. That is a normal process. Okay? So remember, all amino amides, they are metabolized in the liver. That happens with amino amides. But amino esters, where are they metabolized? Amino esters are metabolized in the place where esterases are present. Because amino esters are metabolized by plasma pseudocholinesterase. Where is the esterase present? In the plasma. So all amino esters are metabolized in the plasma by plasma esterases, except an amino ester that is basically sniffed. You guys might be knowing what I am talking about. The amino ester local anesthetic that is sniffed and the abused one. What is that? Cocaine. Cocaine is having metabolism in the liver. So all amino esters are metabolized with the plasma by plasma esterases, except cocaine, which is having metabolism in the liver. Whereas all amino amides, they are metabolized in the liver. Guys, some of the amino esters, after being metabolized in the plasma, they are metabolized to a compound called as PABA. Compound called as what? PABA. You know what is PABA? PABA is para amino benzoic acid. So some of the amino esters, after being metabolized in the plasma, they are metabolized to this compound called as PABA, which can cause allergic reaction. So just write this point over there. Some amino esters are metabolized to PABA. What is PABA? Para amino benzoic acid. It is para amino benzoic acid. Some amino esters are metabolized to PABA, para amino benzoic acid, which can cause allergic reaction. Which can cause what reaction, guys? Which can cause allergic reaction, right? So some amino esters are metabolized to PABA, which can cause allergic reaction. Now guys, look over here. There have been questions asking you which amino esters are metabolized to PABA, which can cause allergic reaction. How I used to write this PABA is, while I was in my UG days and all, or while I was in my PG days, how I used to write this PABA is, I used to write PABA, so that I could remember what are the amino esters that can cause allergic reaction. What are the amino esters? In the amino esters starting with the alphabet P and B can cause allergic reaction. So what amino esters can cause allergic reaction? Maximum incidence of allergic reaction. Maximum incidence of allergic reaction is seen with P stands for Procaine and B stands for benzocaine. P stands for Procaine and B stands for benzocaine. These are the two drugs which can cause allergic reaction. These are the two amino esters which can cause maximum incidence of allergic reaction. So guys, we know the classification, we know the metabolism. Now what else we need to remember is, whenever you give this local anesthetic, where in the body it goes and where it will act. Whenever you give this local anesthetic, it goes on the nerve terminal. We are discussing about the mechanism of action of local anesthetic. The local anesthetic goes on the nerve terminal. It knocks the door of nerve terminal. It asks the nerve terminal, may I come in? The nerve terminal from the door bin, it will see which form of local anesthetic is knocking the door. 99% the one who is knocking the door is in the non-ionized form. 99% when you give local anesthetic, it goes into the body, towards the nerve, towards what, in which form? Non-ionized form. If the non-ionized form is knocking the door, the nerve terminal will open its door and tell the local anesthetic to come inside. So nerve terminal only allows the non-ionized. If ionized form is knocking the door, it won't open the door. So remember, the non-ionized form can enter the nerve. This is the nerve terminal, guys. This is the nerve terminal. So what happens? The non-ionized form of local anesthetic enters the nerve. Once the non-ionized form enters the nerve, then under the influence of pH, what happens? This non-ionized now becomes what? Ionized. This non-ionized form of local anesthetic becomes ionized. And this ionized form of local anesthetic goes towards the main mechanism. What is the main mechanism, guys? What is the main mechanism of local anesthetic? It goes towards the sodium channel. The ionized form goes towards the sodium channel. And what will it do? It will block the sodium channel. It will block the sodium channel. And you guys know, once the sodium channel is blocked, what will happen to depolarization? Once I block the sodium channel, the depolarization is gone. Once the depolarization is gone, there is no action potential. If there is no action potential, there is no pain. There is no pain. So once again, guys, we are talking about what? We are talking about the mechanism of action of local anesthetic. In the mechanism of action of local anesthetic, what we need to remember? The main mechanism. The main mechanism of local anesthetic. What's the main mechanism, guys? The main mechanism of local anesthetic is to block the sodium channel. Is to block the what channel? Sodium channel. Which form of local anesthetic enters the nerve? Main mechanism is important. Which form is entering and which is blocking the sodium channel? Which form is entering the nerve? The non-ionized form enters the nerve. The non-ionized form of local anesthetic enters the nerve. Then after entering the nerve, what will it do? The non-ionized now becomes ionized. Then ionized form of local anesthetic blocks the sodium channel. Blocks the sodium channel. Right? So three things over here are very much important. The main mechanism is what? Block the sodium channel. But before blocking, it has to first enter. In which form is it entering the nerve? It enters the nerve in what form, guys? Non-ionized. Then it blocks the sodium channel in what form, guys? In the ionized form, it is blocking the sodium channel. And once sodium channel is blocked, depolarization is gone, action potential is gone, hence there is no pain. That is the mechanism of action of what? Local anesthetic. Guys, a small question I'll ask you. A patient after receiving a local anesthetic started to have itching. You saw some rashes on the patient's body. What could be the cause of itching or rashes on his body? After receiving a local anesthetic, he complains of itching and rashes. Itching and rashes are a form of allergic reaction. Basically, I'm asking you, what local anesthetic causes allergic reaction? Your answer is amino ester. In the amino ester, what two amino esters? What two amino esters? First of all, why amino esters will cause allergic reaction? Because some of them are metabolized to PABA. What two amino esters are metabolized to PABA? Spelling of PABA, your answer is there. P-A-B-A. P and B we have to remember. P is basically procaine and B is benzocaine that causes allergic reaction. Right? So this is regarding what, guys? This is regarding the mechanism of action of local anesthetic. Now we need to know about the additives. But before going towards additive, again I'll give you a case so that you can understand what are additives, what are they used for. So guys, imagine I'll give you a case of a COVID scenario. COVID, in the COVID time there was lockdown and all, okay? So imagine, and in the COVID time, there was lockdown, the persons were working from home, right? And most of the persons who were having work from home, they were having some disadvantage also. What disadvantage they are having? When you're working from home, guys, people don't, usually the family members and all, they don't know the importance of your work. Some of them, I have seen some of my other friends from the IT background, what they were doing is, they were working from home, at the same time their wives were telling them to cut the vegetables and all. As this part was visible, the hands were not visible and all, so they were also helping in course. Okay? Day-to-day course they were helping. So what was happening at that time, they were working on their laptop and at the same time they were cutting the vegetables. When you are new to this things and all, some accidents will happen. Accident means not that. Some minor accidents can happen. What happened while there was one of my friend who was cutting vegetables. While cutting the vegetables, he was working, and what happened? He developed a cut injury. Imagine he developed a cut injury from this till this part. From here till this part, he had a cut injury. So in the COVID time, the doctors were also very much in the shortage. Why? Because all the aged doctors, they were not going to the practice, right? There were many young doctors. Basically, COVID was managed by many young budding doctors. Again, I am not telling that all aged doctors, but most of the aged doctors, again, they were at the home. Why? Because of the safety concerns and the health issues and all. So anyways, just look over here. My friend had a cut from this part till this part. Right? He went to a clinic nearby. Right? There were some protocols, lockdown protocols, but still he was having a cut injury. He went to a clinic. In the clinic, he showed what? I am having a cut injury from this to this part. There was a junior doctor who was posted in the clinic. There were no senior doctors. The junior doctor told that, okay, I will give you suturing. I'll give you some sutures and all. Right? Even though the junior doctor, he did not know how to give suturing, but in that time, when you don't know how to give suturing, but he don't know means he knew something about suturing, but he was not pro in giving suturing. But at that time, there were no other doctors available. He took the responsibility of giving suturing. My friend asked them, will it be painful during suturing? This junior doctor told, there won't be any pain. My friend asked him, what anesthesia will you give? He told, local anesthesia. The most commonly used local anesthetic worldwide is what, guys? Lidocaine. When you give Lidocaine to a patient, this Lidocaine works for 45 minutes to 1 hour. Lidocaine works for how many minutes, guys? 45 minutes to 1 hour, right? But this junior doctor, he required some 90 minutes of anesthesia. But our Lidocaine was working for 45 minutes to 1 hour only. And Lidocaine was working for 60 minutes. He wanted the anesthesia, the Lidocaine, to work for 90 minutes. What should we do, guys? What should he do, guys? What should the junior doctor do? Why? Because he required 90 minutes to complete the suturing. He requires 90 minutes for Lidocaine to work. But if you are giving a plain Lidocaine, it will work for 60 minutes. But if you add something to Lidocaine, the duration will increase. The duration can increase. Right? What is the thing that can be added to Lidocaine in order to increase the duration? Those drugs are called as additive drugs. Those drugs are called as additive drugs. Additive meaning what? Anything that is added to a local anesthetic in order to increase the duration. In order to increase the duration, decrease the toxicity, is called as additive. Is called as additive. Right? The most commonly used additive drug over here is what? Adrenaline. Okay. So guys, remember additives. We are discussing about what? We are discussing about the drugs called as additives. Additives are the drugs which are added to local anesthetic. When they are added, what will they do? They will increase the duration. They will decrease the toxicity, and they will also decrease the blood loss. They will also decrease the blood loss, right? They are increasing the duration, decreasing the toxicity, and decreasing the blood loss, right? But the main primary function over here of an additive is what? Increasing the duration. All additives increase the duration. In the additives, what we need to remember, what are the additive drugs which can be used? So additives are the drugs which can be added to local anesthetic. The most commonly used additive is what? Adrenaline. The most commonly used additive is what, guys? Adrenaline. When you add adrenaline to Lidocaine, it will increase the duration, decrease the blood loss and decrease the toxicity. But it comes with side effects. You are adding what drug? Adrenaline. When you add adrenaline, what side effects will you see? You will see there is tachycardia, you will see there is hypertension. Adrenaline increases the BP and heart rate, right? Hence, adrenaline is the best, but it should be avoided in what cases? Adrenaline should be avoided with Lidocaine in what cases? Avoided in ischemic heart disease patient, hypertension patient, and places where you have end arteries. Places where you have end arteries. Now look over here, guys. Ischemic heart disease, why are you avoiding? Why? Because in ischemic heart disease, you don't want the patient's blood pressure to suddenly increase nor suddenly decrease. What is adrenaline doing? It is suddenly increasing. Okay? In hypertension, why are you avoiding? Why? Because adrenaline, when you mix it with Lidocaine, it will increase the BP. So you are avoiding in hypertensive patient. But why are you avoiding adrenaline in end arteries? End arteries. First of all, tell me what are the places where you find the end arteries? Fingertips, you will have end artery. Okay? Toe tip, you will have end artery. Penile tip, you will have end artery. Right? And ear tip, you will have end artery. If at all a patient is having a cut injury on his fingertip, you can give Lidocaine, but don't give adrenaline mixed with Lidocaine. Why? If you give Lidocaine on if you give adrenaline on the fingertip, it will cause severe vasoconstriction. End artery meaning what? It is just ending over there. Yani ke, if you block the blood supply, there is no collateral circulation coming up for the help. If I block the blood supply over here, there is no collateral circulation coming up. And what will happen to this tip? It gets ischemic and it develops what? Necrosis or gangrene. Necrosis or gangrene can happen. So remember, guys, adrenaline is the best additive, but avoided in what patients? Hypertension patient, ischemic heart disease patient, and places where you have end arteries. Instead of adrenaline, nowadays we are having a prodrug that is prepared from adrenaline, which is free from systemic side effect, but which is a bit costly. What is that drug called as? Felipressin. The drug is called as what, guys? Felipressin is a synthetic vasopressor which will not increase the BP or pulse rate. So it can be used. Instead of adrenaline, we can use felipressin. Second is what, guys? Remember, we have already discussed. Right? We have already discussed. The second drug is what? Just right there. The second drug over here is sodium bicarbonate. Sodium bicarbonate. Just a second, guys. Sodium bicarbonate. Okay. The second drug over here is sodium bicarbonate. If at all you don't have adrenaline or felipressin available, you go for the second drug, which is called as sodium bicarbonate. Sodium bicarbonate, which is also called as soda bicarb. Soda bicarb. If at all you don't have soda bicarb also available in your hospital, the last drug that can be used as an additive is what? It is an opioid. In opioids, almost all opioids can be used as additive. Almost all opioids can be used as additive except for remifentanil. There are many opioids now, guys. Morphine, fentanyl, alfentanil, sufentanil, many opioids. But remember, all can be used as an additive except remifentanil. Why remifentanil is avoided? Except remifentanil. Especially it is avoided in spinal anesthesia. Especially in, avoided in what anesthesia? Avoided in spinal anesthesia. Why remifentanil is avoided in spinal anesthesia? As it contains neurotoxic preservative. As it contains neurotoxic preservative. Neurotoxic preservative. So remifentanil is avoided in patients who are posted for spinal anesthesia. You never give remifentanil. You can give all other drugs. So guys, in additives, remember there are three additives. The most commonly used additive is vasopressor, that is adrenaline. Second most commonly used is soda bicarb. If soda bicarb is also not there, you go for what? Opioid. Right?